Hey everybody, how's it going? I'm Dr. Christopher Pena. I am the scientific liaison at the University of Chicago Comprehensive Cancer Center, and I'm here with Dr. Mekinda.
Hi, I'm the Assistant Director for Cancer Education, also with the Comprehensive Cancer Center. And we are here with a number of students from our Chicago Eyes on Cancer and Research Start programs. And these are summer cancer research training programs for high school and college students who think that they might like a career in biomedicine. So our students come for the full summer and they work in the laboratories of our faculty doing cancer research projects. And the goal is to teach them a lot of really valuable research skills and career development skills. But importantly, these students are actually contributing to some of the cutting-edge research that's allowing us to understand a lot more about cancer and hopefully how to end it.
Oh, thanks for sharing that with us. So our students are incredibly eager to share some of their research experience and their knowledge with you. This is the third episode in a 4-episode series. Our first episode focused on cancer treatment. Our second episode focused on immunotherapy, and today we're going to specifically talk about prevention and diagnosis of cancer. And in our last episode, we'll talk about survivorship, which is essentially living life and what's associated with that after you get a cancer diagnosis. So thanks for joining us, and I think we're going to go ahead and start with our first couple of students. So again, we are Chicago Eyes on Cancer and Research Start. We're based out of the University of Chicago, and we're a program for high school and undergraduate students who want the opportunity to do summer research in a cancer biology lab. This research can be clinically related or basic science related as well. If you are interested or know someone who is interested, you can visit the website that is on the screen right now, or you can give us a call at 773-702-4678. We'd be happy to answer any questions you have for our programs. And so right now I am here with our first student, Anna. Anna, how are you doing today?
I'm doing great, and yourself?
Great. Thank you so much. Yeah, pretty good, pretty good. So why don't you talk to us a little bit about what some options are to prevent cancer?
Well, there are numerous options to prevent cancer, such as maintaining a healthy, balanced diet, simply wearing sunscreen to block the sun's ultraviolet ray, and not smoking. So smoking is one of the leading causes of lung cancer, which is the #1 cause of death. Smoking does not only cause lung cancer, but can also cause head and neck cancer, oral cancer, bladder cancer, pancreatic cancer, and other health consequences, such as cardiovascular disease, emphysema, and various respiratory illnesses.
Wow. So can you tell me a little bit more about cigarettes and exactly why they're so harmful? I know we hear that a lot, but can you explain a little bit more about
Of course.
that? Mm-hmm.
There are hundreds of chemicals within a cigarette, and once it is lighted up, there are 7,000 active chemicals. And researchers have found that 60 of those chemicals are cancerous. Mm-hmm. One of the most known chemical is nicotine. Nicotine does not cause cancer, but it is highly addictive. Mm-hmm. When nicotine travels into the brain, it travels within a few seconds, and it creates additional receptors, which mm-hmm. is very hard to get rid of. And when a smoker smokes a cigarette releases carbon monoxide into the environment, which is a poisonous gas. So when you breathe too much of carbon monoxide, then you can lessen the amount of oxygen in your body, and is what makes the heart work more.
Wow. So not only is nicotine making you want cigarettes more and more, but in addition to that craving, you're putting in 7,000 additional
Yes.
carcinogens in your body. That's amazing and scary at the same time. So how has smoking been part of what you have learned through your research?
Well, in the lab that I've been working in, it is a clinical addictions research lab where we are addressing the smoking issue by examining some of the health disparities that go along with smoking cessation. Mm-hmm. So statistically, low-income and African Americans have a lower quit rate than middle-class Caucasian men. They also incur more barriers to care and have less access to evidence-based treatments for tobacco dependence.
So how come smoking has mainly affected low-income African Americans in these kinds of situations?
In these kinds of situations, African Americans have a slower metabolism, and the nicotine in their system retains longer, mm-hmm. which makes them crave cigarettes more often. Smoking then becomes a habit. At first, it is something that they want or try, and then becomes a necessity. So this leads to them being more prone to having lung cancer. Not only it can cause harm to one's body, but can also affect younger children, which is commonly known as secondhand smoking.
Wow, so it's not just the smoker, it's also the people around the smoker that get affected.
Correct.
So what are some ways to help smokers quit?
A few tools and ways to help a person quit smoking are by joining support smoking treatment groups, like the ones at the University of Chicago, and one of them is called the Courage to Quit program, which is a therapy class. And smokers can also contact the Illinois Tobacco Quit Line. It is a totally free resource. You can just apply and they will contact you back right away as soon as they can. And there is another therapy called the nicotine replacement therapy, which is either a nicotine patch, lozenge, gum, or a Chantix pill. This therapy does not cause cancer, but it will replace the nicotine from the cigarette and lower the amount of nicotine intake.
So I've never heard of Chantix pill. Can you explain a little bit more about what that is?
Chantix pill is a medication that interferes with the nicotine receptor in the brain to reduce the urge of smoking, and it's what helps eases the withdrawal symptoms.
Right. So for people that quit smoking, are there any kind of benefits that are associated with that?
Yes, there are lots of benefits. Within 20 minutes, their blood pressure rises back to normal. 12 hours, their carbon monoxide and oxygen blood levels. 1 to 2 days, their smelling and taste sense come back to normal as well. And it goes on. And then also, by smoking less, you can save more money, and lots of money. And if you think about it, a pack of cigarettes costs about $12, and if you buy a pack a day, and for a week it'd be $84, and for a whole year it is $4,000.
Wow.
About an average. And with that amount of money, it can be either well spent to pay for your bills, your mortgage, or even a family vacation.
Wow. So there's definitely a lot of benefits that are associated with quitting smoking. So really, thanks for stopping by and sharing that with us. So thanks for coming.
Thank you so much.
So again, we are Chicago Eyes on Cancer and Research Start. We are based out of the University of Chicago, and we are a program for both high school and undergraduate students who want the opportunity to work in a lab that does primarily cancer research. This can be either kind of clinical research, working with patient samples, or it could be a little bit more basic science related. But the fact of the matter is that this is geared towards cancer research and therapy. If you are interested in this program or somebody who, or know somebody who is interested, you can reach us at the website that's listed on the screen, or give us a call at 773-702-4678. So I'll go ahead and continue with my next guest, Ocean. How are you doing today?
Good, how about you?
Good, thank you so much. So we talked a little bit about quitting smoking, decreasing the risk of developing cancer, but are there any other preventative methods that people can take that are being developed in labs right now?
Yeah, there's actually a lot. It's interesting that you bring that up. Doctors are currently working on creating new drugs, especially ones that are more financially accessible, since that's a big problem in cancer right now, especially for treating it. And we're trying to focus on patients who are in high risk of developing cancer before it even appears.
So what kind of drugs are these? What kind of drugs are people currently studying?
So it's interesting that you mentioned that. So remember when I was talking about like financial accessibility? This is a drug that everyone has in their medicine cabinet. It's aspirin.
Wow.
So, yeah. So aspirin has been shown to actually be able to decrease the number of tumors you have in your body, as well as the size and the degree to which they invade nearby tissue, especially in colorectal cancer. So they also believe that if patients who are in high risk of colorectal cancer take this drug on a regular basis, they may never even get it. However, studies are still in the making. We don't know how this really works. What is the dosage amount for a patient? We can't approach this one-size-fits-all approach anymore.
Wow, so I know it may be a little bit more unclear right now, but does anyone have any idea about how aspirin tends to work?
Yeah, so we have like a kind of idea. Like I said, we're still doing more research on it. We need to make sure it's safe. But so right now, many researchers believe aspirin decreases cell proliferation, which is basically when cells grow in an uncontrollable amount, which is something that cancer really needs in order to spread, especially to nearby tissue. But at the same time, it increases cell apoptosis, which is when cancer cells will die. But so what cancer does is that it decreases this function, so then you have cancer cells proliferating, but none of them dying. So here's a video of how this looks on cells being treated with 10 millimolars of aspirin. The colon cancer cells in this video are stained with both green and red dyes. So when the green is expressed, the cancer cells are alive. When they are dead, when they are red, they are dead. So at time 0, the cells are stained green since they are living. And then at 6 hours, the cells are stained both green and red since they are starting to die. At 24 hours, the cells have died, so they have secreted the green dye, causing an escalation of green fluorescent intensity, which can be seen on the graph. Then at 48 hours and 6 minutes, the cells are completely red since they have all died.
Wow, that's a really interesting video you have here. So then you have that green turning to red, and then they're completely gone at that point. So what's really neat about that is how this household drug can have such cancer preventative abilities. That's amazing.
Yeah, it's great. And researchers today are doing amazing things.
Oh, well, thanks for stopping by. Again, we are Chicago Eyes on Cancer and Research Start. We are based out of the University of Chicago, and we are a program for both high school and undergraduate students who are interested in research opportunities in the laboratory setting, specifically those that pertain to cancer research. So our research can be focused more on basic science or on actual clinical oncology, where you're working with patient samples and whatnot. If you are interested in our program, you can visit us at the site listed on the screen, or you can give us a call at 773-702-4678, and we'd greatly love to answer any questions you may have about admissions or just finding out more information about our program. So now I'm here with Lindsay Pearl. How you doing, Lindsay?
Hi, I'm good. You?
Good, thank you so much. So I think we're going to talk a little bit more about preventative measures that you can take. So why don't you tell us a little bit about those?
Okay, so it's important to go on regular checkups because exams and tests can help find a problem before it even starts. And even if there is a problem, your chances for cure and treatment are better because it's found early. By taking charge of your health and getting the right health services, screening and treatments, it'll better your chances of living a longer and healthier life.
So for men and for women, what are some of the kinds of specific screenings that they can do?
Yes, of course. Mammograms, for example, are low-energy X-rays that is commonly used to detect breast cancer. For women with high risk of developing breast cancer, breast MRIs are recommended to detect breast cancer early, meaning women who have breast cancer, a history of breast cancer in their family, should screen with MRI because it is more sensitive to picking up breast cancer compared to a mammogram. Men who want to be screened for prostate cancer should be tested for prostate-specific antigen blood test, and the digital rectal exam can also be used when screening.
Great. So is there anything that people can actually do in their own home to check for breast cancer or even prostate cancer?
Yes, that's a great question. There are specific steps that women can easily find online to do a proper self-exam at home. Self-exams are easy and convenient. It can be done in front of a mirror, in the shower, lying down. As for men, unfortunately, medical professionals do not recommend self-examinations for prostate cancer due to the training required to reach accurate conclusions about the exam.
So you had mentioned about women being at higher risk. So what generally constitutes somebody who is at a higher risk?
So women who have a history of breast cancer in their family.
Oh, good. Okay. And so how often should women and men go for regular checkups or even do self-examinations at home?
For men, regular checkups for prostate cancer really depends on the individual's risk, potential benefits, uncertainties. For example, screening is only recommended for men at certain ages if they are at high risk. Yearly mammograms plus MRI, breast MRI screens are typically recommended for just women who are at high risk for breast cancer. As for self-exams, women should get in the habit of doing a breast self-exam once a month. It should be done several days after period ends. That's when the breast is least likely to be swollen or tender. And for men, we already know that self-examination is not required.
So in terms of for men getting either PSA blood test or digital rectal exam, is there a specific age that would help them with that?
Yeah, from 45, 50, 55, if you're at high risk.
All right. Well, thank you for sharing that with us
Thank
today.
you.
It was great having you. Again, we are Chicago Eyes on Cancer and Research Start. We are a program based out of the University of Chicago. And what we're here to do is give high school and undergraduate students the opportunity to do research in a lab that's related to cancer. So this could be basic science research, understanding how cancer works and some of the fundamental mechanisms behind this, all the way up to clinical research where you're actually working with patient samples and understanding more about diagnosis and treatment. So if you're interested in this program or know somebody who is, you can visit us at the website that's on the screen right now, or you can give us a call at 773-702-4678. I am here with Ocean again. How are you doing?
Good.
Welcome back. So I realize that there are definitely times when no matter what preventative measures you can actually take, you're still going to get diagnosed with cancer, unfortunately. So
Yeah.
can you explain why early detection is key? Even if you did everything in your power to prevent it, you still get it, you got it early. Why is that important?
So yeah, unfortunately, no matter what preventive methods you take, you may still get cancer. However, you're going to hear this a lot, early detection is key. So I'm really quickly going to go what early detection is. So it's basically exactly as it sounds. It's basically when you go under some type of scan, whether it be MRI or CT scan, and they see if you have any tumors that are still in the making. So they can do this, as mentioned, through a CT scan or MRI. So this is extremely important because once cancer spreads, a process known as metastasis, it's way harder to treat, and your survival rate may plummet.
So if early detection is key, are there any kinds of infections or viruses that can actually, that you may have gotten in the past that can cause cancer?
Yeah, so I'm actually researching gastric cancer. It is the third for cancer-related deaths, so it's definitely up there. So in specific to gastric cancer is that doctors are struggling with doing this early detection. By the time they usually get to it, it's spread so quickly. And a lot of that is due to patients not really telling their medical history. So for example, gastric cancer patients, especially in the intestine, they might have gotten an infection of H. pylori. So H. pylori has been commonly affiliated with gastric cancer, especially for the intestine, as mentioned. And basically, in the event that you do get infections such like this, you should definitely tell your healthcare provider right away so they can start doing some type of screening to see if you do have gastric cancer.
So besides that, what are other certain symptoms associated with cancer?
So all cancers are different, and each cancer has certain symptoms associated with it. A lot of times, if a certain symptom is prevalent, a doctor will order an MRI or CT scan. Mm-hmm. It really depends on what the doctor feels is right and what is best for you. That being said, for gastric cancer in particular, one symptom that is like really prevalent is ascites fluid. So ascites fluid is basically this fluid buildup in your abdomen. It usually is around 1 liter to 3 liters in amount, and it can spread up to your lungs. And in that fluid, there are cancer cells. So what they'll do is they'll drain that fluid through a needle, and they'll send it to the lab. In the lab, they will see if there are cancer cells present. So right now, we're thinking this is a form of metastasis and cancerous part. And symptoms such as like ascites fluid, which is like a form of metastasis, can tell us if certain cancers or what stage they are at. So if there are cancer cells present, doctors will most likely order some type of scan for you. But at the same time, they aren't really 100% sure if that is for sure a malignant tumor.
So is there a way to find 100% accuracy if you do in fact have a tumor?
Yeah, so a doctor would have to do a biopsy on you. So a biopsy is basically when they take a small piece of tissue, whether through endoscopy, a needle, or through surgery. Contrary to common belief, a tumor doesn't always mean you have cancer. A tumor can be benign, meaning it is not harmful, or malignant, meaning it is harmful. So if a tumor is found to be malignant, they will most likely order a type of CT scan or MRI.
So what I know about the difference between benign and malignancy is that in a benign tumor, what you typically see is that it doesn't invade to other tissue. And in a malignant tumor, you typically see something where it's invading to surrounding tissue. So with that, we're gonna transition back to our main screen here, and we're gonna tell you a little bit about our program, Chicago Eyes on Cancer and Research Start. We're a program based out of the University of Chicago. We are for high school and undergraduate students, and this is an opportunity for students to get involved in research pertaining to the that can be participated in the laboratory. If you're interested in our program, you may visit us at the website listed on the screen, or you can give us a call at 773-702-4678. And so I am back again with two of our great, amazing researchers, and you guys are going to answer some more questions about your overall experience in laboratories. So what was that like in the summer?
So for me in particular, I'm a high school senior, and I never really had that much lab experience, especially in my high school, as to be expected. So when I moved to UChicago for a program, I worked in a specific lab that was affiliated with gastric cancer. It was very different for me because I didn't know a lot of the methods they were using. I didn't really know the correct protocols for it. So it was like a big learning experience in that type of sense, but they do help you through it. They don't expect you to know everything.
Yes, and to top that, in my lab it has been amazing. Working with all these my lab mates, it has been they have been very supportive with me. If I have any questions, concerns, or if I don't know anything, they will help me out. And I like the fact how they treat me like an adult. They don't just treat me like you're a high school student. And I feel like it's very comfortable and welcoming.
Great. So for both of you, how has this experience kind of prepared you for your futures?
So yeah, for us, like we're both high school rising seniors, we want to know what's the correct major for us, what's the correct college to go to, right? And definitely going through a program like this tells us whether or not science is for us, whether or not we want to really spend our careers or the majority of our lives in a laboratory. And it also helps us determine like what university we want to go to, like which one is really strong in research, which one will help us through the process of wanting to become researchers. Especially like what's the correct major for us.
And also, during this experience, we learned the difference between the PH route and the MD route. And most high school students want to do the PH and MD route.
Right. So thanks for sharing that with us. So I think we're going to have Dr. Mekinda back here. And again, we are Chicago Eyes on Cancer and Research Start. We're a program based out of the University of Chicago. And if you are interested, you can visit us at the website on the screen or give us a call at 773-702-4678. So welcome back,
Just
Dr.
want to let
Mekinda.
concerned viewers know we have gotten Ocean some water.
That'll work.
She's fine.
I'm glad to hear that.
She's
I am
recovering
very glad
nicely.
to hear that.
Yeah.
Thank you. So, I think overall, if we want to end this, who is eligible for these programs?
Sure. So there's two separate programs, and they have somewhat different eligibility requirements. So for Chicago Eyes on Cancer, this is a program for high school students who are in their sophomore, junior, or senior year when they apply. And it's also for college students who are freshmen and sophomores in college when they apply. And just for the first year, we started also accepting high school science educators. So if you are a science teacher in high school in biology, chemistry, really any like broad range of science, and if you feel like that this kind of immersive experience in one of our cancer research laboratories would be meaningful to you, please apply, and we can help you learn how to take that experience and give you some of the materials and the supplies and the support that you need to take that experience back into your classrooms to hopefully inspire even more young people into this field of science.
Great. So, one last word of advice that you would have for applicants.
Sorry, real quick, I just want to say for Research Start, that is a program for high school students, so juniors and seniors in high school. Word of advice for applicants, we pay attention to why you're joining our program and we read your essays. So what we're looking for are students who are really passionate about this work, who are willing to invest an entire summer or 2 summers working full-time in these laboratories. It's challenging work and we expect a lot of our students, so we're looking to make sure that we are picking people who are ready to invest in that kind of commitment.
And as you've seen here, our students here are amazing. And They know
Amazing.
so much about their research, and we couldn't be any more proud of them.
No.
So with that, we want to thank everybody for tuning in, and catch us on our next episode, which is going to be cancer survivorship, or how to live with cancer. Thank you.
Thank you.
Thank you.